start with the very basics, right? What is this disease?
Okay, thank you so much. Endometriosis, just like you said, is a mouthful. And now it's actually a very funny disease in the sense that it's I would say, misplaced endometrium.
Okay.
Okay, endometrium is the inner line of the uterus that a woman sheds every month.
Ah.
So the menstruum
Okay.
is actually the endometrium being shed.
Okay.
Now, sometimes for whatever reasons, this endometrium is misplaced or displaced and is in other places. So it could be on the ovary, which is probably the commonest place where it can be,
Okay.
or it can just be generally in the abdomen.
Okay.
It can be on the intestine, and
Okay.
sometimes it actually wanders above the belly completely. It can wander into the lungs. It can actually wander into the brain, but that happens rarely, but it can happen.
Okay.
So, and what happens is that, just like the endometrium, what it does normally, you build it up. If you're not pregnant, you shed it. Okay, the same thing happens to wherever this implant or the endometrial implant, the endometrium, the misplaced endometrium is. Wherever it is, you're bleeding there as well. So you can imagine if it's in the abdomen, is that every month as the woman bleeds, normally she's also bleeding into the abdomen.
Oh my God.
If it's in the chest, if every month as she's bleeding, she's also bleeding into her lungs. So if it's in the brain, every month when she's bleeding into the brain. So that's where it usually has this devastating effect, or just like you said, debilitating effect, because the chronic disease that most of the time you have to manage in the lifetime.
1 out of 10 women, that's a huge number.
It's humongous, but the sad part is that majority of the patients are not even diagnosed.
How is that possible?
Yeah, because, okay, in Africa, until about 25 years ago, we believed that endometriosis was not a disease for black people.
Oh.
So some of the doctors are still living in that cloud.
Oh.
So they still believe that it's not here.
Oh.
Okay, but even where they believe that it's there, because of the fact that the symptoms are not really peculiar, they're not the kind of thing that you say, okay, I have a headache, I'm shivering, this is likely to be malaria. It could be, depends on where these implants are deposited. So symptoms tend to vary from one woman to the other. And also for some people, they don't even have any symptoms at all.
Oh.
So you see, so that's where this great spectrum of symptoms makes it very confusing. And then even for women who have symptoms, some of these symptoms are so personal. I can't have sex. When I try to have sex with my husband, it's too painful. Sometimes they don't really want to discuss it. And over time, some girls, okay, imagine a family where there are 4 girls, 5 girls, and only one. Every month, the world comes to a stop. Okay, the other people are saying, oh, what's wrong with Bimbo now? Aren't we all menstruating? So over time, Bimbo learns to live with the pain.
Keep quiet.
Yeah. And so that because she's stigmatized, she goes to the doctor. The doctor says, well, I can't find anything wrong with you. This one is a malingra. Maybe it's here in your head, So these are some of the things, what these people always go through. So we say most of the time they have these 3 M's. They're misdiagnosed, they are misunderstood, and then they are mistreated.
This sounds depressing. So a disease that is hard to diagnose, what's the hope of somebody who may have it? Because you've said the spectrum is quite large.
Yeah.
So it's ranging from women with lots of symptoms to women with no symptoms at all. How we want to do?
Okay, that's why the whole world is talking about awareness.
Yes.
Okay, because if the doctor has it in his mind, if the patient has it in her mind, because we're not seeing patients who are asking doctors, do you think I have endometriosis?
Good.
And that not only in Nigeria, all over the world. Okay, but in advanced countries like UK, US, between time that onset of symptoms and when diagnosis is made is about 8 to 12 years.
Oh my God.
Those are in places where the health system works.
It's fantastic, yeah.
In Nigeria, until recently, majority of our women were going to their grave with their endometriosis. Some of them had become depressed. Some of them had actually become really crazy from this. Nobody understands you.
Nobody believes you.
Nobody believes you. You cannot keep a home because you can't have intercourse. You can't keep a job because every month, maybe 4 or 5 days, you are off work. You can't go to school because every month you are 4 or 5 days you are off school. So it's a lot of burden that some of these women have been bearing, and nobody seems to know about it. Nobody seems to care about it.
So what are some of the symptoms that I should pay attention to, which will make me ask my doctor, do you think this is endometriosis?
Thank you. That nice question. Pain is number one.
Pain.
Now, this pain could now take all kinds of forms. Okay. Don't forget we said the symptom depends on where the deposits are.
Yeah.
So for some women, it's just that they just have this pain that is not going away in the abdomen.
Okay.
Okay.
Ever.
Just there.
It's just there. Constant
Just there.
pain. Okay.
And for some of them, they only have it when they are menstruating.
Okay.
The pain comes when they are menstruating and everything stops.
Okay.
Okay. For some, it's a mixture of the two. The pain is always there. It becomes worse when there is
During
menses.
menstruate, okay.
Now, for some, it's that when they want to pee, when they are menstruating, they can see blood.
Okay. But isn't that normal for all of us?
No, you see, for them, it's a little bit more than, what happens sometimes that there's contamination of urine. And
yeah.
that's different.
Okay.
Okay, you
Okay.
see that. But this is something you see consistently with
Okay.
these people.
Okay.
Or for sometimes they want to go to they want to go and poo and then they have a lot of pain. Okay, pain is part of this. It's not just that there's blood. Okay, they have a lot of pain and then sometimes they see blood also when they poo.
Okay.
But usually it's during the time that they're menstruating.
Okay.
That all this, for some people, it's that when they're having sex, like we said, it's very painful. Just like you are happy to have sex and then suddenly this pain comes on. Somebody had called me at 2 a.m. before that. Doctor, I was just trying to, and then this pain just came on, So then for some, is that they are bleeding from abnormal places.
Okay.
Some can be bleeding from the umbilicus,
Okay.
the navel. They
Okay.
are bleeding from the navel.
Okay.
And for some, they are bleeding from even some.
From the nose.
So it's varied. But also infertility is another thing, because about 50%, 30 to 50% of people who have infertility also have endometriosis.
That's the next thing I was going to ask about, because WHO data suggests that almost, like you said, half of the people who have it, So why does this happen? How frequently does it lead to infertility? Why does it happen?
Okay, let's say take the why. So don't forget we said that you're bleeding into the abdomen. Okay. So blood is not supposed to be in the abdomen. So what happens that there's an organ called the policeman of the abdomen, which is, we call it omentum. So what it does is it tries to arrest.
I like that, the policeman of the abdomen. I like that.
So it tries to arrest anything that is going on that is funny,
Okay. Okay.
So suddenly there is blood in the abdomen. So the omentum goes there to arrest the situation.
What I do here.
Yeah, what are you doing here? But next month it's going to come again. And so after a while, you see that there is what we call inflammation. The organs start gumming together.
Ooh.
So that's what causes the pain. Most of the time, that's what causes the pain.
Okay.
But also because of the distortion in the anatomy of the organs, infertility also can come.
Okay.
But don't forget again that there is blood in the abdomen. So the sperm and the egg meeting together, this is also affected. So there's so many ways that implantation even is affected. So there are so many ways that it causes infertility.
What causes endometriosis? Why does someone's uterus inner lining, suddenly start going mad?
Yeah, that's the word. Actually, it's going mad. Yeah, but we really don't know. There's some theories that have been proposed, but we can't put a finger at this. We think the genes is part of it.
Okay.
For example, we believe is an current knowledge is saying that is even endometriosis is more than something happening in your abdomen. There is a more generalized systemic inflammatory disease.
Okay.
You understand? So
Okay.
the immune system is one of the things that we're thinking might just be one of the problems, because
So it could be an autoimmune disease?
that's the current thinking, because it's also associated with some autoimmune diseases like rheumatoid arthritis,
Okay.
like lupus.
Okay.
Yeah, like what do you call it? Lupus. So it's also, there's one that's to come
Yeah,
into,
to come back.
autoimmune.
Yeah.
So, but we think it's an autoimmune thing. That's the current thinking. But
Okay.
this knowledge in endometriosis has been evolving over the last 20 years all over the world.
Right.
Because suddenly we have seen that we'll be missing something big in women.
Because 1 in 10.
Yes.
1 in 10.
Yes. And you see, the major word is that the quality of life. It affects greatly the quality of life of sufferers. When they can't keep jobs, they can't keep homes, they can't, and some of them you really see that their temper, of course, they're not the best friends to have.
Yeah, I'm in pain
Somebody
all
that
the
is always in
time.
pain.
You best believe I won't be.
They're not your best friend.
Yeah.
Some of them are already hooked on analgesics.
Yeah.
So they're not, they just, and nobody seems to understand what is happening to them.
Yeah. So let's talk early detection before I go to Lagos, because Lagos is already calling me. I think they're panicking a bit. What are the earliest symptoms of endometriosis?
Wow, nice one, because that's really what we're trying to face now.
Early detection, right?
Yeah.
How do you detect a disease that you can't detect?
No, but you can detect it. It's just you just have to have a high index of suspicion.
Okay.
All right, and that's what we're saying now. That the thing is, adolescents face the adolescents, because we know that majority of people with symptoms of endometriosis, 60% of them will have it before age 20. So if we can immediately start
paying more attention to the girls,
awareness programs,
okay,
to the mothers, to the teachers, to people they work with, and for the girls themselves to know that this might be endometriosis, to the doctors, so that everybody can be on the lookout for this thing that likes to hide, as it were. Some patients they cough out blood, and the doctors are saying that it's tuberculosis. They place them on anticox
TB medicine
for 9 months, and it is endometriosis. Yeah. So unless we start talking about it, and then people start thinking more about endometriosis. But what we say, summary of everything to the girls, is that any menstrual pain that disturbs your normal chores is not normal. So don't settle for it. Don't let anybody make you think that you are abnormal. If you have that kind of thing, go to the doctor. And do not rest until they make a diagnosis.